TB is a bacteria that spreads when you get when someone cough or sneezes, cough, and then you breathe in, and then it develops disease in your body, especially your lungs and other parts of the body. So it is a bacteria that can actually make you feel sick, very sick. But it is bacteria that responds very well to treatment. So we have some of the best treatment in the world. So in short, it is sickness, but it's very curable. It is treatable. This TB is first of all, to start off with, somebody had let's say the usual TB, usual TB that's sensitive to the drugs. So in regards to TB, we have the first line drugs. These are the very powerful medicine that respond very well to these drugs. So the TB responds very well to this medicine. But if someone does not take them, then the bacteria becomes non-responsive. It doesn't respond. So that is why it is a little bit challenging to treat those people who have this type of TB. But when it comes to transmission, it is the same bacteria. It transmits the same way. So whether you have the normal usual TB or the drug-resistant TB, you can transmit it the same way. When someone with TB in the lungs, when they're coughing especially, they will put out the bacteria into the air, and anyone else can breathe in the bacteria, and then it goes into their body, and it can cause disease and infection and all that. So it's the same bacteria. It's just that this type of bacteria doesn't respond to the usual drugs. So it's not like they spread much faster or less faster. They spread exactly the same way. So if you are being exposed to TB, either you are exposed to the resistant one or the sensitive one. TB can exist in any part of your body, but the most common site that TB normally affects is your lungs. So anything that happens in your lungs, you will be having symptoms connected to that. So the most common symptom for TB is cough. If you have been coughing for more than 2 weeks, it's most likely TB or another chronic infection. So it's always good to go for a check. The other thing that normally can make you feel sick, and then you know it's TB or not, is if you have weight loss, poor appetite. If you have not been eating well for the last 2 weeks, you're losing a lot of weight, and also sometimes you're sweating a lot in the night. Then you can probably think it could be TB. So you can go for a check. So most important symptom to look out for is cough, just cough, fever as well. Cough, fever, night sweats, or weight loss. Those are the most common symptoms, but any organ of the body can be affected. So if you feel sick, you just go for a check. Now TB test is available in almost all government health facilities across the country. All major health centers have these diagnostic new tools that we are talking about, especially the Gene Expert is available. In most of the provinces, X-rays are available. So it's good to always go for a check if you feel unwell or if you have one of those more signs of TB, symptoms of TB. I think families, the biggest thing they can do is they need to support the person who has TB. If someone is feeling sick, they need to support that person to actually go and get a diagnosis, support that person. Once the patient is diagnosed with TB, support that person to take the treatment, accompany them to the health facilities, collect the supply for them. Once they're at home, actually support them. We in TB we have directly supervised treatment program, which means that someone actually like observe you, be there encouraging you, supporting you to take the treatment. It also motivates the person, provides strong moral support, but also addresses a lot of this stigma around TB. So the most important thing any person in PNG can do is if you have a family undergoing TB or is suffering from TB, just be there to love them, care for them, support them. I think having a strong family around TB is a game changer for us, because we have seen, like in the past, around this program, those people who have been directly supervised or who have received support, they tend to do very well. They have very high treatment success rates compared to those who didn't have support from families. So for any family in PNG, it's now is our time to support people with TB.